I've got two things. My first question is for Dr. Orchard. I was just wondering why it seems like a number of kids today, after they, as you know, when Sam had his transplant, ERT didn't exist. And I know they get it before the transplant, and they get it after the transplant until they know that they're engrafted and everything. But it seems like a number of kids continue to get ERT for a number of years, and I was wondering why. And I was also wondering what you consider to be a sufficient enzyme number.
Well, so no. Okay, there we go. So those are related questions. So one of the issues, it seems, is the more enzyme you get, the better off you do. And I didn't show any of that data, but people have compared, for instance, the gene therapy approaches in the mice to regular transplant. And if you can make more enzyme from a gene therapy approach, the bones look better, the brain looks better. So the mice are more completely respond than with transplant itself. So how can you deliver more enzyme ends up being the question. So as part of that, after you go through transplant, we know those cells are delivering some enzyme, but would additional enzyme be more helpful? And that was the circumstance where we were exploring trying to give more enzyme and see if it might make a difference. So Linda alluded to a study we did before, which essentially kids had to be at least a few years out after transplant. We put them on enzyme, see if their GAGs came down and if they got any better. So the study that hasn't been done and would be important to do would be to have two groups of kids, ones that stopped enzyme soon after transplant and another group that stayed on enzyme potentially for years to see if it made any difference. So that has not been done, and we would love to do it, but it would be a big study and an expensive study, and Sanofi would have to help us do it. Yeah. So I don't have any compelling information that staying on enzyme makes a difference. It's just that there's some evidence that more enzyme is better, and I think that's the situation, really.
But when kids have been post-transplant for a number of years, you wouldn't do ERT because antibodies can build up, isn't that correct?
Well, there have been some patients that have gone through transplant, stayed on enzyme for a while, tried to come off, and then went back on it because they think the kids weren't doing quite as well. So it's pretty anecdotal. It's certainly not a a study sort of scenario, but
thanks.
What's
a good enzyme number? What do you consider as a sufficient enzyme number?
Well, so the thing is, when we do the transplants and we do the enzyme levels, we're just looking at donor cells. So we just take blood out and spin out the cells that are the donor cells and look at enzyme there. And you'd expect it to be normal, assuming they're all donor cells. It doesn't tell you, though, that you're delivering normal amounts of enzyme to the liver, or to the brain, or to the heart, or to any of the other tissues. I mean, you almost have to stick needles in those places and try to get an idea. And obviously, we don't do too much of that.
Okay. And I just wanted to let people here know that Dr. Pineda did Sam's DALK procedure on his eyes. I have two great pictures on my phone if anybody wants to see it, and he's a skilled surgeon.
Hi, this is Jason. I'm on your left, in the corner here. My daughter was diagnosed with Morquio at 3, and she's 4 now. And I noticed from a genetic therapy and research perspective, I haven't seen anything, and I'm wondering if you knew why. Are they just not going to be helpful for her version, or are the others more attractive for a reason?
Just so I understand the question, so she's been on enzyme and it doesn't seem like it's made much difference. Is that what you're?
No, it seems, well, so I guess she's on enzyme, but I'm wondering why there aren't also gene therapies being researched.
Oh, that's a good question. I think there are groups that are working on it, but I don't know that there's anything coming down the pike anytime soon. But I would agree. I think we need other things to offer. I mean, you can better speak to it than I, but at least from what I've heard, it's great to have enzyme, but it doesn't work as well as we would like it to, certainly.
Hi, this is for Dr. Pineda. We're considering having corneal transplant on our daughter, and I was hoping you could speak to what factors we might be considering between doing the procedure now and waiting for new technologies and new therapies.
Sure. How old's your daughter?
15.
15. So in terms of kind of maybe the future of corneal transplantation, obviously the cornea is an ideal target organ for cell therapy and for treatment because it's right there. You can actually see it. I mean, it's actually has lots of genetic potentials. I'm not aware of anybody working on anything right now specifically for MPS. I think that one of the messages I was trying to send is, you know, I think that the older the patient is when they have a transplant, I think 15 is very appropriate, you know, they are more likely to do better with the compliance piece afterwards, and also they're getting to a stage of their life where they might need those additional visual improvements in order to function better. I think DULC has actually been a big step forward in how we manage this disease, and most of the, I mean, again, I would talk with other patients or patient families that have had DULC procedures to kind of get their perspective on things. But in terms of other therapies or approaches to corneal transplantation, we're not looking at anything real soon. I mean, maybe in a decade, but nothing like in the next few years. And there's no studies that I know of that are focused on any kind of other thing than artificial corneas, which I don't think is the way to go for MPS patients at this time. The other word I would caution is that there are not a lot of DULC procedures done in the United States. There's not a lot of surgeons that do a lot of DULC surgery. It's much more commonly performed outside the US. Part of it's stylistic and part of it is kind of what's needed in those areas. You know, we do about 50,000 corneal transplants in the US a year. Only 500 of those 50,000 are DULC. So it's a very small number.
So I'm sorry, we have to cut off questions now, but we want to thank the doctors for being with us. And please catch them afterwards for questions.